For over 2 decades, menopause hormone therapy has carried the FDA's black box warning label, and this language implies that there are major risks with menopause hormone therapy, but that was based on misinterpreted data. So, in other words, yes, there have been women for the past 2+ decades who have been suffering unnecessarily because they've been afraid to take it and their doctors have been afraid to prescribe it. So, what does this mean? Well, first of all, I want to clarify that today's discussion was on estrogen specifically. There are other menopause hormone therapies to take. The other is there's by no means a mandate that everyone should be on menopause hormone therapy. That is a discussion for you and your doctor. But the reason why this is important is, again, that fear of not taking it. Now, what's interesting is they didn't specify if this black box warning is for all estrogen or if they're speaking about vaginal estrogen specifically, because they are different. So I'm going to speak to this as if it's vaginal estrogen because I feel like there's just not enough discussion about vaginal estrogen. So why is it so important? Well, after you've delivered a baby or once you've hit menopause, you have all these hormone changes that are happening. And what that creates is dryness in your vagina and vulva. And as a result of that, you can get urinary tract infections, recurrent ones, by the way, pain with sex, and so many other factors. And if you just took vaginal estrogen, it would prevent all of these things from happening. And as you get older, if you can believe it, one of the main causes of hospital visits and hospital stays for older women is recurrent UTIs. There are women who die from this. So can you imagine that because a label was incorrectly put on a product because of misinterpreted data and fear-mongering, women who could have survived, dealt with less pain, had a better sex life, and all of these other factors would be fine. So this is huge, huge news. And again, we are not at all here to say everyone must be on hormone therapy, but if it is right for you, we now can take the fear away. And I just want to thank all the clinicians who did this, because I know there's so many frustrations with women's health, but this goes to show that if you get the right stakeholders in a room having the right conversations and it is evidence-based, then change can happen. So let's never give up. This shows us that we can do this. So congratulations to the entire team that worked their butts off to make this happen. Thrilled to see this announcement. And women, go talk to your doctors. And if you want, you can listen to the entire hearing. It was just, or not the hearing, but the discussion today was, 20, 30 minutes. You can go on YouTube and search for it if you want to hear all the great quotes and the details. And I'm just really, really excited. So spread the word.